driving the obesity, driving the diabetes, that is driving the hypertension, and through all these things, it is driving the heart diseases. And the other thing that drives the heart diseases in the present day world is the pollution. Even air pollution will increase the risk of heart disease. And more importantly, the sedentary lifestyle also is increasing the heart disease risk. See, whenever the people are sedentary, it is equal to as if they are smoking. A lot of young guys, they don't exercise. They should consider themselves as smokers as far as the heart disease risk is concerned. That's why the new saying is sitting is the new smoking. Now, if you don't move in the entire day, that means that you are having the same cardiovascular risk as a smoker. So, increased movement, increased exercise should be there. At least 150 minutes of exercise per week is what the American Heart Association recommends. So, definitely you should exercise at least for half an hour, at least 5 days a week. That is something that you should be able to do even if you are very busy. Because I am busy and I end up doing slightly more than that. So you have to do the exercise. And then one last important, very important risk factor, which has increased tremendously after the COVID episode, is the psychological stress. The psychological stress directly contributes to heart disease and it contributes to heart attacks. And once the heart attacks come, they lead to sudden cardiac arrest. So the important thing to note is stress has to come down. So how do we reduce stress? That will come to in a minute. But these are the risk factors. Now to recount these risk factors, hypertension, diabetes, smoking, and the cholesterol, and the obesity, sedentary lifestyle, pollution, and even the psychological stress. And one or two more important risk factors we have to understand. Genetics are the most important risk factors. And family history of heart disease, if it is there. What do you mean by family history? Family history means that father or first degree relative, that means father or brother, having a heart disease in less than 55 years of age, and first degree female relative, mother or sister, having a heart disease in less than 65 years of age. These are called family history of heart disease. If there is a family history of heart disease, your chance of having the heart attack is higher. So that is a non-modifiable risk factor. So that means we cannot change that risk. The other risk is being born in India. Being born in India itself will confer you an additional risk of heart disease. In America, they have done a study with all the different Native Americans, like they have taken the Red Indians, they have taken Japanese, they have taken Chinese, they have taken Koreans, they have taken Brazilians, they have taken Mexicans, they have taken Indians, they have taken Caucasians. And then they have studied and then tried to find out in whom the heart disease risk is highest. Because people from all over these countries, they are there in the United States of America. And then what did they find? The heart disease risk is highest in Indians. And then the Indians who are there in the United States are the healthier lot. You have to see that they are very careful with their health. Whenever they come to India, you can see how they behave. They don't eat this, they don't eat that, they don't drink water here, they don't do this. All precautions they take. They carry a bottle of sanitizers in their hands. They are that careful. And if that lot has a higher risk of heart disease among all the world's population, you can see that we Indians who are living in India have much a higher risk. And then in India, the heart disease comes as it is in younger people than in US. In US, the heart diseases come in 60 to 70 years. In India, they come in between 50 to 60 years mostly. And then nowadays it is becoming less than 40 years also. But usually the more than 50 years is the age when heart attacks happen in India. unlike in the West, where the heart attacks happen after 60 years. Now, I've been using two terms interchangeably. One is a heart attack, another is a cardiac arrest. I need to clarify these two. Heart attack is a block in the blood vessels supplying the heart. So, if there is a block in the blood vessels supplying the heart, what happens is a portion of the heart muscle dies. This is actually called a heart attack. And then what is a cardiac arrest? The cardiac arrest means that the heart has stopped. And unless you have done something, the heart will also stop the rest of the organs because the circulation is not happening. The heart is stopped. So the blood supply to all the other organs also will stop. So the person dies in a few minutes if CPR is not performed immediately. So that is a cardiac arrest. This is the difference between a heart attack and a cardiac arrest. This is significant. So now we have to understand what are the other reasons that people are having heart disease. The most important doubt that you all have is whether COVID vaccine is contributing to this or not. That is the fundamental question that all of you will have. I would say it is not. Why? There are studies. AIMS people have conducted a study in which what they have found is the people who have been vaccinated have much lesser heart attack risk than people who have not been vaccinated. That is one evidence. And recently, one more study was done, which was published in a major journal. And this time also, the result is as if the people who are vaccinated are more protected than those who are not. Let us not believe that. Let us think about common sense. Now, there are two kinds of vaccines that were given in India. One is a Covaxin, another is a Covishield. Covaxin doesn't have any vascular side effects. That means no clots will form with Covaxin. And then, so because of that, maybe Covaxin doesn't increase the heart attack risk. Now, what about Covishield? Covishield does have a risk factor with the blood vessels in the body. That is, sometimes clots can form within the blood vessels of the body with Covishield. That is what is known as vaccine-induced thrombocytopenic thrombosis. That is also known as VITT. So in this, what happens? The platelets fall down, and then patients will have a clotting risk. So usually the clotting happens in the veins of the brain, but rarely. Let us give it, even other blood vessels also can be involved, and even heart blood vessels also can be involved rarely. But what are the statistics saying? After Covishield, the risk peaks after first 1 month, before the second vaccine dose is taken. And the risk is substantially less with the second vaccine dose. So temporally speaking, the main things, the clots, what all happen with Covishield vaccine, they happen only within the first 1 month after the dose. And it has been what, 3 years or more since all of us have taken Covishield. So the temporal chance of having a clots all these years later after you have taken Covishield is very, very, very unlikely. The other factor you have to consider is the fact that the clots with Covishield, they happen 60% to 70% of them happen in young women, not in men. They are more common in women than in men. But the cardiac arrests, the heart attacks that are happening even now are predominantly in men. Very rarely you are seeing a young woman having the sudden cardiac arrest, except the dancer that she was dancing in a Sangeet in the UP, I think. You have all the people who have seen on camera who have a heart attack or a cardiac arrest are men. That means predominantly these are males that are being affected, whereas with vaccine, it is predominantly ladies that were getting affected. So with these two commonsensical thinking, you can conclude that vaccine is not the cause of the heart attacks that are happening in the present day. So that is what is happening. Now, what should we do? Like, okay, given that Definitely heart attacks are increasing post-COVID. Definitely more amount of these heart attacks or cardiac arrests are being recorded on the phones, in the cameras, and then they're being put on social media by everyone. So that's why more panic is there among the people rather than the actual number of deaths. Definitely increased heart attacks are there, but panic is much more than what is actually there. That is number two. Number three, the risk factors for having a heart attack have increased tremendously after the COVID episode. What we have seen is even smoking rates have gone up after COVID. We would have thought otherwise, but even smoking rates have gone up. The food habits have become bad. The exercise has come down. The stress has gone up. And COVID also affects the blood vessels. All these factors together are pushing younger and younger people to have a heart attack. Now, I've been saying that the cardiac heart attack and the cardiac arrest are different. But what are the causes for the heart attack? For the causes of the heart attack, it is important to notice that the risk factors that we have told, these are the reasons for having a heart attack. But what are the reasons for cardiac arrest? The most common cause for having a cardiac arrest is heart attack itself. So many of these young people who are dying suddenly, they have a heart attack only. But a significant number of people who have a cardiac arrest in the young age, they do not have heart attacks. They have cardiac arrest without having a heart attack. So, what is this entity? Why is it important? You have to notice this. The lady who has died on the Sangeet, that's an young lady. She died in around 21 or 22 years, I believe. She had a brother who died at 14 years of age. So, what is happening here? If you think that it is a heart attack that killed this lady, do you think that the 14-year-old also had a heart attack? No. This thing is a familial thing, and then this caused a cardiac arrest without a heart attack. So, what are these conditions which can cause a cardiac arrest without having a heart attack? These are the important causes. Heart attack means cholesterol block, these things. But there is no heart attack here, but the cardiac arrest has come. These are some disorders which are inherited, which cause rhythm disturbances of the heart. I'll cite some examples. The most important things are hypertrophic obstructive cardiomyopathy, also known as HOCM. So, hypertrophic obstructive cardiomyopathy, Brugada syndrome, long QT syndrome, short QT syndrome, arrhythmogenic right ventricular cardiomyopathy, and catecholanergic CPVT, calculomnergic polymorphic ventricular tachycardia. That's also known as CPVT. So these are some of the conditions which are inherited and which may cause sudden cardiac arrest even without a heart attack. Now these people will be normal until suddenly they collapse and die. So how to detect them? Mostly one ECG and one 2D echo will help us to detect these people. But sometimes it may not be evident. Sometimes it may require higher tests. But basically, these are the tests that are required. But the governments cannot recommend these tests for everyone. Let us say the incidence of these things happening is 1 in 1 lakh. And to detect that one individual who might have a sudden cardiac arrest, we cannot ask the rest of the people to get tested for all these tests. So that's why the government will not indicate that these tests can be done. So to detect this, what are the tests to be done? ECG, 2D echo, and the risk is there. A treadmill test also needs to be done. So with ECG, 2D echo, and treadmill, these three tests, majority of the risk of cardiac arrest can be seen in these patients. If there is any problem, you can see. More often than not, people do only ECG and 2D echo, and ECG and 2D echo can be normal even half an hour before having a patient having a heart attack. That's why you should also do a treadmill test. and then see. These tests are recommended for everyone after 40 and even younger if there are risk factors. And in children or in very young people, if there is a risk of sudden cardiac death, we need to do these tests. When will we know if there is a risk of sudden cardiac death? If the patients or the people have giddiness, chest pain, or palpitation, or if there is a heart attack or cardiac arrest in the family, then we need to test these younger people to see if there is a risk of having a heart attack. So that is important. And getting the test is one thing, and modifying the lifestyle is another thing. And how do we modify the lifestyle? We have to we have to know the numbers. What are the numbers? We have to note our height and weight, and we have to calculate our BMI. We have to check our blood pressure. We have to check our blood sugar. We have to check our fasting lipid profile or other lipid parameters that may be important. So we'll take them one by one. So BMI has to be less than 25. If it is more than 25, we call it overweight. If it is more than 30, we call it obese. And BMI may not be adequate in defining the cardiac risk. Sometimes waist to hip ratio can also be taken. That is the basic thing about being overweight. And then the second thing is hypertension. Hypertension can be defined as more than 140 by 90 millimeters of mercury in the office, or more than 130 by 80 millimeters of mercury at home. Please note that the BP normals are different at home and the office. In office, it is more, and at home, it is less. So you have to keep the BP definitely less than 140 by 90 at office or less than 130 by 80 at home. This is one important thing to note, because treating blood pressure doesn't have many side effects, definitely helps, and what all the risk that increased BP gives you will be totally gone by treating the blood pressure. Blood sugar is not like that. Blood sugar will give you an increased risk if it is high, but even treating the blood sugar totally to be normal will not reduce the risk 100%. So previously, diabetic medication used to be accepted based on the fact whether they are reducing the blood sugar or not. Now, new medicines in diabetes are not being accepted like that. If a new medicine has to come, it has to show that the cardiac risk because of this diabetes should also come down. So all the new medicines that have come to market, these are called GLP-1 analogs or SGLT2 inhibitors. These things, they reduce the risk of having a heart attack in people with diabetes. That's why the new medicines have to be preferred over the old medicines. And it is not enough to control the blood sugar in diabetics. It is important to control the overall risk by reducing the other risk factors, by looking at the blood pressure and controlling it carefully, by controlling the cholesterol if it is high carefully. What are the cholesterol levels normally? An LDL of less than 100 is normal. If it is more than 100, it is abnormal. If it is more than 190, we have to treat it regardless of whether the patient has a previous cardiac problem or not. If the patient has a previous cardiac problem, or if the patient is diabetic, then the LDL levels have to be less than 100. The triglycerides, the normal value is less than 150. And if the triglycerides are more than 150, we have to modify the lifestyle to bring it down. But medication will be needed when the triglycerides are more than 500. So we don't have to treat it with medicines when the triglycerides are less than 500. That is important. And good cholesterol, if it is low, can cause heart attacks. So HDL has to be more than 40, and then we have to make sure that the HDL comes up by exercise or eating prudently. So that is important. So cholesterol numbers are these. Sugar numbers, we've already noted. A fasting sugar level of more than 126 is the definition for diabetes. Or HbA1c level of more than 6.5 itself makes you a diabetic. So if that is the level of the diabetics, we have to bring it down less than that by initially trying with lifestyle modification. If the lifestyle modification doesn't work, then we have to take medication. That is the important thing. So what other ways that we can help us ourselves not to have the heart attacks? Can we prevent having heart attacks? 90% of the heart attacks can be prevented with lifestyle and drugs. So we have to make sure that we take care of that. We all know the precautions, but none of us will follow that. We all know that biryanis are not good, but yet we'll eat once in a week at least some biryani, and then to add to it, we'll add some cool drinks also to it, because Swiggy will give it free to you. We'll add that as well. So we know that the cool drinks are not good. We know that the biryani is not good. We know that smoking is not good. We know that alcohol is not good. We know a lot of things. We know that sedentary lifestyle is not good. We know that being fat is not good. But still we keep on adhering to high risk habits. And that's why the heart attacks are growing. So we have to make sure that we reduce these risks by following a proper healthy lifestyle. And then one more important aspect that we have to do is to learn to do CPR, that is cardiopulmonary resuscitation. Unfortunately, most of the people in India don't know how to resuscitate. And some of the doctors too, they don't know how to resuscitate. So we have to take it into the public, how to do a CPR properly. And then we have to make sure that public access defibrillators or automated external defibrillators, which can give a shock and save a person's life whenever he has a cardiac arrest, they should be available in all areas where the public is there, even in railway stations or airports or in function halls, in gyms. In these places, if there is equipment which can be used to do a proper CPR, proper basic life support, then a lot of lives can be saved. But not just keeping the equipment, people have to know how to use that equipment. So if they are able to use that equipment and save people, slowly it will percolate into the public, and then slowly we can reduce the number of deaths that are happening. One more important thing that we should know is that we should always do a post-mortem for the people who die young. That's not been happening. If we do a post-mortem only, we'll come to know if there is a heart attack or if there is a cardiac arrest without heart attack. And if at all a cardiac arrest has happened, or if at all a heart attack has happened, we have to note that just to help his siblings or her siblings so that they'll be safe, their deaths can be prevented on one hand, and on the other hand, the panic in general public can go. Lot of celebrities deaths are there which scare people, but what we have to know is some of these celebrities are smokers in real life, and then we cannot talk about it when we are talking about that celebrity, because that thing is private thing, so we cannot call him a smoker or anything. So that's why people consider this as a big mystery why they have had a heart attack. But in fact, the usual explanation is very simple. His own cardiologist will know, but he cannot tell it outside because of ethical reasons. Because of that ethical reason, people are having panic. And then panic is not at all necessary. And then we all have to reduce the amount of mental stress that we go through. And how to reduce the mental stress? By exercising and by doing meditation. These are the two fundamentally important ways of reducing stress. If you walk every day for an hour, and in that hour, if you are able to cover a distance of 6 kilometers, that will reduce your having a heart attack immensely. And that will also reduce your stress. And meditation for 20 minutes a day will definitely reduce the stress. If you tell someone to reduce the stress, it is very difficult to reduce it on its own. But if they do exercise and if they do proper meditation, then the risk will come down. So, ladies and gentlemen, These are some of the points that I wanted to make tonight, this evening. So the first important thing is the heart attacks or the sudden cardiac deaths in young, they have been happening much before COVID. It's not something new, but they are increasing in number and frequency, and there are several reasons for this. One among them is COVID, and the other reasons being the changing lifestyle, the increasing habits like smoking and vaping, and not only that, because the obesity is increasing, hypertension is increasing, diabetes is increasing, mental stress is increasing. These are the reasons why the heart attacks are happening in young. How to reduce these risks? One, we have to know the risk and then reduce the risk by taking proper precautions or medications. Two, we have to know how to do CPR, and then we have to make people learn CPR. And finally, we have to subject these people, whoever have died young, to postmortems to know the exact reason why this has happened. I am stopping the topic because it's already been 40 to 50 minutes. I'd like to leave this forum for some of the discussion. If you have any questions, you can ask me. I'll try and answer them. Thank you so much, MedWorld. You have given me a great opportunity to connect with people and then explain them why these deaths are happening. I really thank you for that. Thank you. Boss, are you there?
Hello, sir.
Yeah. I think we'll leave the floor for some discussion so that we can
Yes.
answer some of the questions. Are there any texted questions so far? I did not see. If there are any questions here, we'll answer them one by one. Mahesh Vadapalli has asked a question. He asked, what is arrhythmia? Arrhythmia is a rhythm disturbance of the heart. Normally, the heart has to beat between 60 to 100 times, and then this has to be in a regular way. But if the heart is slower than 60, or if the heart is beating more than 100, or if the heart is beating irregularly, this is known as arrhythmia. And then some of these arrhythmias can be dangerous. Sometimes the heart suddenly beats 250 times a minute and then stops. These are called ventricular arrhythmias. So, if at all that kind of dangerous arrhythmias happen, they have cardiac arrest. Even heart attacks also, because of the rhythm disturbances only, the cardiac arrests happen.
So a small reminder for everyone. So we will be taking the questions in the chat for the next 2 minutes. And after that, we will be stop taking the questions. So just for your information. So anybody have any kind of questions, you can keep it in the.
Yeah, one more question Kiran has asked. What is rotablation? Rotablation is a technique whereby, let us say, if there is a lot of calcium in the blood vessels supplying the heart, let us say sometimes it is a cholesterol plaque, sometimes it is a fatty plaque, sometimes it is a calcified plaque. That means a lot of calcium is there. Whenever calcium is there, we cannot expand the stents properly. When we put a stent, the stents will not be expanded properly. That's why we have to drill through the calcium and scrape off the excess calcium and then put a stent. One of the implements that we have at our disposal is rotablation. Rotablation is a fast moving burr, a drill, which moves around 170,000 RPM. And then it shaves off the calcium, leaving the blood vessel for stenting. That is rotablation. Mr. Qureshi says that if a 24-year-old person has a heart attack, Should he undergo open heart surgery or angiography? See, basically angiography is a diagnostic test. It is not a treatment. So based on the angiography, we'll decide whether the medicines will do, or if we have to place a stent, or if you have to do a surgery. During the heart attack, if we do an angiogram, that is only to stent, because during the heart attack, if we do a cardiac surgery, open heart surgery, bypass surgery, that will be a high risk surgery. There is a high risk that the patient might die on the table. That's why during the heart attacks, even if the anatomy is difficult, we try to place a stent only. And that has to be placed as early as possible. So if at all someone has a heart attack, he has to reach a cardiac hospital immediately. And then if they advise angiography, get the angiography done and then get stented. So 24-year-old, usually we try to avoid bypass surgery. But any heart attack, during any heart attack, the treatment would be placing a stent rather than going for a surgery. So next, Harsha. What are the early warning signs of heart disease? Important. See, how do we identify the pain if it is related to heart or not? This is important. The heart pain is in the center, not on the left side, not on the right side. Usually it is in the center. And then if it is a heart pain, you will not be able to show it with the finger of your hand. It will be diffuse all over the heart, all over the chest. And then more importantly, it will be increasing while you are walking and it will stop when you stop. When you walk, it will increase. When you stop, it will decrease. That is how cardiac pain starts. So even if it is burning, don't think that it is gastritis. That is a very dangerous thing. Even if it is burning, if it is increasing on walking, that means it is heart related. That is very important. So any pain, chest pain that increases on walking is a very important thing. The other early warning signs are breathing difficulty. Sometimes you may have a syncopal episode, either giddiness or falling down. That is also dangerous. And sometimes we have to see palpitations. They indicate some rhythm disturbance. If the heart is beating slow, too slow or too fast, then also we should get the checkup done. Sir, do you think that Vrishank, yeah. Do you think that we should keep tables such as nitrate tablets such as nitrates or aspirin for emergency situation, like US citizens keep adrenaline for allergies? Yeah, they have EpiPen, they keep it. But these tablets are more dangerous rather than not. Nitrates or aspirin, you have asked. It is important. See, if you have a heart attack, it is important to take aspirin. But even doctors miss if they have a heart attack. Can you diagnose on your own whether you have a heart attack or not? 90% of the times you might be having gastritis. 10% of the times you may be having a heart attack. So without realizing that you have a gastric problem, if you take aspirin or clopidogrel or whatever medicines, these are the blood thinners. There is severe gastritis, it can bleed into the stomach. So it is important in a heart attack situation to reach the hospital as early as possible without trying to take any tablets. The tablets can be given in the hospital. Reaching the hospital is more important. If you have a cardiac arrest, someone has to do a CPR. If you have a heart attack, you have to rush to a nearby hospital. That is the difference. No need to take any medicines. Nitrates, what happens is some heart attacks will have higher blood pressures. It is helpful in those situations. Some heart attacks will have a low blood pressure. If the blood pressure is already low, if you put a nitrate tablet, the blood pressure will fall precipitously and then it may lead to a cardiac arrest. So nitrates have to be given if there is a heart attack and the BP is high. If there is no BP is normal or low, then nitrates, keeping nitrates could be a problem. Please post any other questions. Okay, sir, may know the durability or length, lifespan of angioplasty. Is there a chance that it may need to be repeated? Unfortunately, angioplasty, sometimes if it is done, sometimes the reblocks can happen in the stents. Because stent is a foreign material, body will try to reject it. And it will be able to reject it in 7 to 10% of the people. But in majority of the people, the stents will work for the entire life. By 1 year, if the stents are working fine, that means that usually they'll work for the entire life. But if at all the block comes, the block will come in the first 6 months to 1 year. So we have to watch very carefully after angioplasty. Is there any genetic tests that are available to detect heart diseases? Yes, Kiran. Genetic testing is available, but not for all the diseases. Like coronary artery disease, we don't usually do genetic testing. But there are some diseases like hypertrophic obstructive cardiomyopathy, which are amenable for genetic testing. In those diseases, we do a genetic testing. Even Brugada, long QT, short QT syndrome, in these things also, there are genetic testings available. So usually they are expensive. Usually they are not for everyone. If the family member has a heart disease similar to that, then they'll do a genetic testing. What are some of the latest advancements in cardiology? Harsha, there are a lot of latest advancements. Most important thing is valve replacement, which can be done percutaneously. Previously, valve replacement required opening of the chest and doing. Now we are doing valve replacements from the groin. So this is simple, and then this can be done off, and then within 1 or 2 days the patient can go home. This is a major breakthrough in the heart disease. And the second thing is the latest molecules are coming for treating new problems. Like lipoprotein A is one of the risk factors that is there. New medicines are coming to treat that. They have not yet come into the market. The other major thing is injectables for treating cholesterol. Now, one of the injections can be given once in 6 months so that high cholesterol patients can reasonably take this injection and then be done with it. Just one injection every 6 months. But the problem is it is very expensive as of now. Slowly it might come down. And other advances are the new medicines which have come for congestive heart failure. These are helping a lot of people in heart failure also. And robotics are not that common in cardiology, but they are also coming. The another thing is minimal access cardiac surgery, where in Pulse we do the cardiac surgery from a small incision below the breast without actually having to open the breastbone. So that is the advantage. Previously, only 1 or 2 grafts would be able to be done with that. Now we are doing a thing called TCART. TCART means the total coronary arterial revascularization with minimal access. So these are some of the latest developments that are there. Vijay, what kind of exercise is safe and effective for heart health? Two important things that are important for heart health are cardio exercises and resistance exercises. Both are important for heart. Cardio exercises, they maintain your physique, they keep you fit, and resistance exercises, they reduce the insulin resistance, they increase the muscle bulk, which is actually helpful for the heart. So whatever is the exercise, you start slow and gradually you step it up. Don't rush into exercise. That's why mishaps happen in gym. So start slow and slowly increase your exercise, either the cardio exercises or the weight training exercise. Slowly try to increase it. So one of my friends is facing Raju. One of my friends is facing heartbeats faster when she dances or climbing steps. Feels like dizziness and cannot open her eyes all of a sudden. Is it because of having less blood percentage? No, she needs further investigation. If the anemia is there of the cause, then that should be treated. But definitely, when she is climbing steps, if the heart is beating too fast, we have to identify the reason. The commonest reasons are anemia and thyroid disease. But we have to see the exact reason why this is happening. And based on that, she needs to be treated. So it is important, Razu, for her to be tested.
Thank you so much, sir. Thank you so much for your time and for patiently answering all these questions. So right now, we have one of our co-hosts with us, Jahnavi. And Jahnavi,
Yeah. Hi everyone, this is Janvi. Thank you so much for being here today. And of course, a big shout out to Dr. Mukherjee Garu for the incredible session. And before we wrap up, I want to quickly introduce you to the platform that made today's webinar possible. It's MedWorld Expo. MedWorld isn't just a platform, it's a full-scale digital medical expo that runs all year round. And it basically brings, yeah. So it basically brings healthcare professionals, manufacturers, distributors, and health service providers from across the globe in one place. So if you are a medical or healthcare organization or a healthcare professional, here what you can do on MedWorld. So basically, first you can join or host webinars like this one. So we will regularly organize free sessions with industry experts, and you can even select your specialization. So you will only get notified about events that matters to you. And you can also apply for jobs and post jobs in healthcare space. You can connect and network with other medical professionals, and you can discover the latest medical technologies and equipment. So apart from all these, we also offer CME courses, web blogs, community, trending insights, and access to a wide range of brands, making it easy for you to connect, collaborate, and source equipment. So, whether you are looking to grow your career or expand your business or just to stay informed, MedWorld here helps you to do it all, like faster and on a global scale. So, right now, the platform includes 2,500 plus manufacturers, 1,700 plus distributors, and nearly 600 plus healthcare services, and overall 60,000 plus medical products available for you guys to explore on the website. So this is about MedWorld, and if you haven't checked it out, please explore our website. And our next webinar is on 2nd May. So the topic is clinical evaluation and management of acute abdomen by Dr. Sri Venu Aitagaru. So if you guys are interested, you can register, and for more details, you can always check out medworldexpo.com. And thank you so much for being with us today. And with that, I'll hand it back to Dr. Mukherjee Garu in case he would like to share any final thoughts before we close this.
This is a great platform, and I really wish you all the best. All the best.
Thank you, sir. Thank you so much.
Good night.
Krishna?
Thank you so much, Jahnavi, and thank you so much, Mukherjee sir, for your valuable time and taking your time and explaining what are the major things that have been concerning young people these days. And thank you for each and every participant that have taken part and taken your time to come in and attend this webinar. And yeah, so hope you have a good evening, and let's meet in our next webinar. Have a good day, guys.